Everyone. I'm Jegathevi a third-year medical student from Taylor's University. And this forum today is a collaboration between Taylor's University Medical Society and Taylor's University Psych Society. So without further ado, let's move on to the session today. Okay, so before I actually start, I would like to thank all the frontliners outside there for their service to the nation. We salute you. So and also our sincere apologies to every single participant who has been receiving multiple emails from our side because we were having some glitches. So we hope that it wouldn't be much of an issue. Thank you. And all right, so without procrastinating anything, I would like to pass on the mic to the president of Taylor's University for the term 2021-2022, Alan. Thank you.
Thank you, committee. A very good evening to all. On behalf of the organizing committee, I'd like to welcome all of you here today. In collaboration with Taylor's Psychology Society, TUMS would like to bring awareness on mental health among university students through this event. With this pandemic and even the enhanced MCU implemented yesterday, we see a rise in mental health issues, especially among university students. We have a lineup of knowledgeable and inspiring speakers here today: Dr. Anasuya, Mr. Evans, Kriti representing School of Medicine, and Leanne representing School of Psychology. I would like to thank you all and also the speakers for your time today. And I hope all of us will get a better insight on mental health by the end of this forum. It is utmost important that all of you who are going through depression or struggling with your mental health issues in any way to know that you're not alone and should not face this alone. Therefore, as a community, let's support each other to get through this together. As the phrase says, kita jaga kita. Once again, thank you all for joining our forum here today and stay safe. Thank you. Over to you, Kriti.
Thank you, Alan. Okay, so next, I will pass it to Mr. Evan for his short speech on the initiative brought on by Taylor's School of Medicine, Taylor's University Medical Society, as well as the Psychology Department, Counseling Services Department, to provide a counseling service program to all medical students. So over to you, Mr. Evan. I think Mr. Evan is having some technical.
He was kicked out into the waiting room just now.
Oh, okay. All right, right, doctor.
He's back. Evan?
We've added him back in, right?
Can you hear me now?
Yes.
Yes, Mr. Evan.
Camera also on?
Yes.
Hi, thank God. All right. Sorry. Good evening, everyone. My name's Evan. I'm the senior counselor from Taylor's University. Sorry for the technical issue that ended up there's some slight delay. So let me talk about, first of all, let me introduce my department, and also subsequently I'm going to share some of the services that some of the things you're going to do for the students from this, especially students from the School of Medicine. All right. The Center for Counseling Services, or in short, we call it CCS, is a center that we provide not only just counseling service, but we also do other things for students. The main aim of our center is actually to support students so that they be more aware about themselves, and not only that, but also to help them to overcome whatever challenges they encounter. All right. This during the counseling session is a safe space for anyone to talk about their concerns, and all the things we discuss during the session will be confidential. All right. So the main services that we provide in the counseling center include individual counseling, group counseling, psychological consultation, and career counseling. Okay, there are totally 4, but we have other services as well during that we do in the counseling center. Okay, I'm well aware that during this pandemic, for the past 1.5 for the past 1.5 year, it have been affecting students in many different ways. All right, like especially that medical students. I even talked to some of you who are who are quite concerned about the things that's going on with their education and also the training. So what the Center for Counseling Services would like to support, would like to do in order to support you during this point of time is, of course, first of all, we will be open to conduct counseling session, and we provide our services to each one of you. Despite some of you studying, we are not on campus. All our sessions these days are conducted online, so you can book a session. All right, I believe some of your team, some of your peers could share with you the how to book our session. All our session you can meet us through Skype, Zoom, or even Microsoft Teams. So there are 3 platforms you can use to get connected with us. So what you can do, you want to request to talk to a counselor, is fill up the application form, and one of the counselor will attend to you. But besides that, we also do conduct group counseling and support group, and also talks and workshop. So one of the things that the Center for Counseling Services can do is to create a specialized support group for medical students, so that all of you will be able to join this group and share not only experience, but while you're sharing your experience, this workshop on support group will be something to help you to learn something. Okay, to learn about skills such as overcoming anxiety, maybe skills related to your self-confidence. So it's all up to you. So there is no specific topic, but this support group is not only just to learn, just to support you, but also a learning group where you will learn something, maybe a knowledge or a skill while you're inside the group. So this is something that we are also going to do for the School of Medicine. All right. So I think I'll look forward to all of you. In case you got anything if you want to reach out to us, feel free to reach out to us. You can contact us through email. We also have our own hotline number. And last but not least, you can also reach us by Campus Central portal. And yeah, okay. That's all from my side, and I'll look forward to see all of you. Thank you.
Thank you, Mr. Evan. Okay, so before we move on, right, I would just like to mention that at the end of our forum, there'll be a Q&A session. So for that, we'll be using Slido. One of the members would be putting up the code as well as the link for the Slido, and you guys can feel free to just put up your questions up there. Okay, so the theme for our forum today is mental health, and we have picked on a topic specifically on depression among university students. Okay, so now our guest today, our professional speaker here, together with us, we have Dr. Anasuya Jegathesan, the Program Director, Masters of Counselling, School of Liberal Arts and Sciences, Taylor's University. And we have got Rishan Charles, a representative from Taylor's University Medical Society, a 4th-year student, Bachelor of Medicine, Bachelor of Surgery, Taylor's University. And our third speaker today, we have Leanne, a student from Taylor's University doing Bachelor of Psychology. So now let us welcome them, and without further ado, I think we can start our session. Yeah. Okay. So all right. So how this session is going to be, I'm be asking a few questions to the speakers today, and then they will carry it on from there. Okay, so welcome, Dr. A, and thank you for joining us today.
My pleasure.
And thank you. All right, thank you, Rishan. Thank you, Leanne. We appreciate your time and your energy together today with us.
So how formal is the session? It's Saturday night. Can we like relax
It's,
a bit?
it's more of a
It's a
forum.
very serious topic, but we can crack jokes. Okay.
Sure, Dr. A. All right. Okay, so let us start off with the usual question that everyone has in mind. Okay, Dr. A, from your perspective, right, what is depression? Are there any stages to it, or are there any types of depression?
Well, you've major depressive disorder. When you have major depressive disorder, you need to go to the hospital, you need to go and see a psychiatrist, and you need to get medicine. That is at the extreme end of depression. So it's like, you know, when people have got, I always like to do a similarity of depression with, what's that one on blood sugar, when you have got diabetes.
Diabetes, yeah.
So you can have precursors to diabetes. You're at the age of diabetes, and then you can have a serious case of diabetes. So major depressive disorder is the serious case of diabetes where you require medication. But for most of us, we are not at the serious end of the diabetic spectrum, of depression spectrum. We are at the beginning stages or middle stages. At this stage, you can still control it with behavior, with thoughts, with action. But here's the catch. If you don't want to go on medication for your whole life, if you don't want depression to become major depressive disorder, it's not easy. Same like it is not easy to stop diabetes, to arrest diabetes. It's doable. You focus on reducing your sugar levels, on exercise, on different things. It is doable, but it's not easy. And nobody ever said that the activities that require you to arrest your feelings of depression from becoming major depressive disorder is going to be easy. But it can be done, especially when you guys are university students. At your age, you have to consider, do you really want to go down the line of taking pills for most of your life? Or do you want to take the hard steps? And it is hard. It is not easy. It is painful. It is a challenge. I'm going to really state this. I'm going to emphasize it because a lot of people make it sound damn easy to overcome depression. It is not. It is really a struggle, and it's a success story when you do. Because a lot of people just go down the line of getting major depressive disorder and needing drugs. So if you can arrest it, and if you can put the effort and the diligence into arresting it, then it becomes, I'm depressed for a few weeks, I'm depressed for a few months, but at the end of the day, I choose to be in charge of my emotions and not have my emotions be in charge of me. Because that's our choice. You either let your emotions be in charge of you and run your whole brain and run your whole heart and run your whole head and basically run it into the ground, because our emotions on a negative scale tend to go wee bang. Or we decide that, you know what, it's my life. And as hard as it is, I am not going to be controlled by a drug. That's your choice. And you guys are at young enough age where the choice is pertinent. There you go.
Okay, thank you. So this depression or depressive disorder, so the end point is where the medications or the drugs come in, right?
Yep.
Okay, so before that you have several steps which are not easy, but it is not impossible as well.
Yep.
Okay. Yes. Okay, doctor, thank you. All right, so Rishan, so following what Dr. Anasuya has said, right, what do you think, is depression an illness, disease, or a sickness? Your thoughts on it? Thank you.
So it's my thoughts, okay? It's my opinion. how I see it, it's a mood disorder. So again, I feel like depression is it's more likely a mental illness than it is a disease or a sickness. It's because I had to do some research on this, all right? Because it's a very tricky question. So if I am making any mistakes, Dr. A, please do correct me, all right? So a disease is when you deal with the pathology, right? It's what the doctors identify and then later they manage, okay? And there would be abnormalities in the functions of the body system, so the organs. That's what you classify as a disease, right? An illness is what a patient experiences, where the patient goes through a change in their state of being and a change in their social function, okay? And sickness is when is what is perceived by the society, right? So again, in my opinion, I would say depression is not exactly a disease, but it's a human experience where there's a set of psychological responses to the events and circumstances of the person's lives, right? It's what they've gone through. So that's why I would say it's an illness instead of a disease or a sickness.
I totally agree with you, Rishan. Leanne, Dr. A, anything that you would like to add on or your opinion on this?
It's just I wanted to add that the minute you said mood disorder, it just reminded me of class. I'm like, correct. Yeah, so you did your research.
Yeah, I did, because it's a tricky question again.
Okay. Dr. A, I think.
No. I'm going to let medical stuff be covered by people doing medicine and all that. Go ahead. Y'all did your definitional studies very well.
Yeah, but
job.
that's all I had to say. So
But it's correct.
okay,
So what you had to say was correct. So there you go.
all right.
Thank you, Dr. A. Okay, Leanne. So this one's for you. How
Right?
can you hear me?
Yeah, I can.
Okay. So this one's for you, yeah. Okay, so how can you identify, or how would someone be able to identify or know that they're actually going through depression?
Okay, I'm gonna answer this question in terms of, say it's someone you know, your friend, someone around you, instead as compared to a complete stranger, right? So one of the most straightforward way or sign that we can look at is they're feeling more sad, down, and lack of better word, depressed, as you would notice, as compared to before. They sort of give off this very hopeless, helpless kind of vibe in a way, and they kind of portray themselves as worthless. They sort of, there's this sense of self-loathing that comes along with it. For some cases, not everyone, of course, but in some cases, of course, it would come through. There are also this other symptom that comes along is that if you know your friend well enough, you would know that it would notice that if they were to lose interest in something that they used to love. Say, for example, this my friend, he really likes to play basketball, and all of a sudden he's like, I really don't want to go to basketball. He completely loses interest in basketball. Or a friend who really likes to paint and completely loses interest or inspiration to paint. Now that can be a very important sign as to steps towards depression. Another thing that is very common among university students, so you have to be careful when you look at this symptom, is when they're always fatigued and tired. So you can see that they have trouble focusing sometimes, and it kind of interferes with their memory. They might forget small things along the way in the day. It might affect them, but it's not, it's not 100%, it might happen. And some of the more physical symptoms could be change in appetite. So it could be extreme weight gain or weight loss, or it could be sleep disturbance, where they sleep very little, or they could end up oversleeping. Now, these are just some very general symptoms that you can look into. Of course, it differs from person to person, and of course, there are other symptoms as well. Do correct me if I'm wrong, Dr. A. But yeah, those are the things that we can look out for as friends. Yeah.
Okay, thank you, Leanne. Rishan, what about you? Your experience on this?
I agree what Leanne had to say. All right, so you identify them like what you said. Like there's this word that we learned back in psychiatry. It's called Anidonia, right? So it's when the individual doesn't feel pleasure in the activities they used to, enjoy. All right. So when these things occur, all right, that's how you can tell that there is something that is not normal, right? So that's what I wanted to point out. Right? There's nothing else I have to add because Leanne actually covered it pretty well.
I'm only going to add one thing. I'm just going to jump in before you invite me. Because I'm going to add is a dragging sense of fatigue. It's like every day getting out of bed. I mean, yeah, it is a pain to get out of the bed sometimes, but usually it's like 3-4 days and then it stops. But when you are going longer than that, you don't want to see sunlight. You want to see darkness. You suddenly have a reaction to bright stuff. You are tired, and the tired is feeding the tired. You allow the tired to feed the tired. So the more tired you are, the more you sleep. The more you give in to sleep, the more sleepy you get. So these are early signs of depression. So if somebody doesn't want to get out of bed, usually you try to wake them up. They're normally tired. Okay, but usually when they really like something, they will get up. But this time, even for the things they really like, they may be extra tired or extra fatigued. So that's when you start, okay, maybe something's wrong. So that can be signs. Just to add that.
Thank you, Dr. A. Okay, so Rishan, all right, there's a quote, or there's a saying that goes, when you know someone's facing depression, you never ask them why. So the question is, how do you approach someone who has depression, and why do you not ask why?
All right. So again, I'll say what I. So how do you approach someone who has depression, right?
Mhm.
People who know. First of all, it's important for us to be aware of these kind of things, right? We should do our own reading. It's a topic that trends on social media very often. So we should keep ourselves up to date, right? Because it's even right now in the pandemic, it's a very uh, important situation there, right? So we have to understand and recognize what these people are going through, right? And we shouldn't tell them things like, some people, this is based on a post I saw recently, right? Some people have it worse. So instead of asking them why they're going through it, or like, some people are having it worse, so you shouldn't be complaining about this stuff, right? You should recognize what they're going through and tell them they're allowed to feel that way and accept what they're feeling without judgments. Right, that's how I think you should. The first step of approaching these people, these individuals, right? You should be compassionate. You should listen to what they have to say instead of just jumping in and saying what you think. Right? It's better to always listen first before you give advice. All right, and it's also important to be more open to everything they say, even if it comes to serious topics such as suicide. Right, you cannot think of it as a taboo topic anymore. It happens, so you have to acknowledge it, recognize it, and face it. All right, and the thing is, when you want to approach these individuals, it's better to take it gently, right, instead of just forcing them to do what they uh, feel uncomfortable with, right? As it is, they're going through something, right? So you don't want to force anything upon them, right? So you have to take a gentle approach, right? And it's always important for you to advise them to seek help if you don't think you're qualified enough to be able to help them. But even though you don't think that you're able to help them in other ways, you can still always be there for them and support them, right? You can uh, lead by support, right? Show them that, like what Dr. A mentioned earlier, right? Don't let your emotions be in charge, right? You take charge, all right? So you can show them this, all right? Uh, yeah, that's how I would approach these individuals.
Thank you, Rishan. Okay, Dr. A, your take on this.
Okay, firstly, as soon as you asked the question, I posted in the chat that I'll be impressed if you could answer it, Rishan, and the answer is impressed. Well done.
Thank you, Dr.
Okay, I'm just going to add a few things of why you don't ask why.
Mhm.
One, when you ask the question why, what you're doing is you're asking people to justify something they don't know. If I'm asking you why, I'm asking you to give me a reason for an emotional state that you don't want to be in. If you knew the reason for that emotional state that you don't want to be in, you would be able to do something about it. So when somebody asks you, why are you feeling bad? It's like, you know, Why are you asking me that question? It can be quite insulting. Or it can be you're asking somebody to give you a logical reason or something that seems logical for an answer they don't really have. They're going to give you a justification that is false. So if you want to ask a question, specific questions like what caused it, when did it start, if you're looking at the magic, the five W's and one H, the only one you don't ask is why. All the others are not justification, they are facts. So these are facts that could tell you the actual story. Whereas why is asking for an opinion or a judgment that the client does not have. Somebody who's experiencing depression does not know really, if they actually knew why, you wouldn't be there. You
True.
wouldn't be in depression. Simple as that.
Okay, right, Dr. A. All right, so in that, 5W questions, you exclude why. So again, we come to the question of what are the causes of depression among university students? The main causes, the common
Love.
ones. Love. Okay.
Okay. No. Let me take that back. That's the second biggest one. Okay. I'm okay to be brutal. I'm gonna probably
Yes,
offend.
yes.
My opinion is probably
Feel
gonna
free,
offend.
doctor. No,
I'm
no, no,
gonna
no.
say it's my opinion. Okay. Reason number one: your parents. The reason number one most of y'all are depressed is your parents and the parenting systems and what's happening with your parents, and the fact that the way that you're brought up and the way that you want to be is now in conflict. You want to be a different person and your parents want you to be one person. Okay, that is one of the main reasons why people have depression. Second reason you'll have depression is you're in love with somebody who doesn't love you back, or you have a crush, and God help you if you crush, because what does a crush mean? A crush means you're going to get crushed. That's why it's called a crush. It's amazing that y'all haven't figured it out yet. A crush means you are doomed to failure. Don't get crushes. Crushes is a one-sided thing. Okay, it's ridiculous. All right, you only fall in love when people already love you. Then you fall in love. If not, get crushed on movie stars because they will never love you back. Okay, that's what it means. All right. So, to be very brutal about it, the first one that actually does cause that is so when you talk about what causes depression, it is unrealized expectations. The bottom line, if you're talking about it in various situations. So if I'm talking about unrealized expectations, then you can have expectations about school, about your results. Some of you may come from schools which are, y'all are number one in class and y'all are really good in class. And then you come to university and suddenly everybody used to be number one in class. Now I'm talking to medical students especially. You guys used to be like the cream of the crop. Now suddenly y'all are average.
I agree.
Okay. And that is depressing because your expectation was that in school and all that, in my small pond, I was one of the best. Now in this in this bigger river, suddenly I'm a small fish as well. And that is hard. Don't kid yourselves on how hard that is. That is very difficult because it's gone to a core of your self-esteem. It's a lot of students who are A students, their self-esteem is built up on this idea that I am one of the best students in my class. Your self-identity is that I'm one of the best students in class. Now you're in university and everybody is a best student. And everybody is good. And somebody is better than you. And that core is now being challenged. And that can lead to depression simply because even though you are doing well, in your head, you should be doing better. And your head is the one that's going to, that expectations in your head, it's what's going to trip you up and get you into that position of problems. Same way with your parents' unrealized expectations. It means that your parents have expectations of you. You may have agreed with those expectations when you were younger because you didn't know better or you thought that's what you wanted. But as you got older, your wants, your needs, your view of life changed and your parents didn't. So you've got a clash of expectations there. Same thing with the crush, love, marriage, and all that. So the bottom line of depression, the start point of it, is always going to be unrealized expectations. That's in my point of view. And there are lots of other theories about it. I like to keep it simple when I'm talking to students and talking to clients. And I think this is as simple as I can get it. Okay, that's it. I hope I made sense.
Yes, doctor. Okay, I'm sure what you said, right, is what most students over here as well as outside there face. So as a student, how do you actually tackle the situation when it comes to parents' high expectations? So yeah.
Sorry, you're asking me again. What was the question?
Okay, doctor. So as a student, okay, say for as a student myself, how would I be able to tackle the situation when I have parents who have high expectations out of me? Yeah.
The easiest way to tackle it, or a more practical way of tackling it?
I would say practical way, because that's what parents are looking
Easiest way
for.
of the easiest way of tackling it is lie, because that's what all of y'all do anyway. Okay, and some of y'all are experts in it. And anybody who tells me they don't lie right now is basically lying. So we shall go there. Okay, but a practical way of dealing with your parents. If I could actually bottle up the answer and give you the answer, I'd be a millionaire. Since I'm not a millionaire, obviously I can't bottle up an answer, but I can give you some practical issues. Number one, change the way you talk to them. I don't mean go rude. And what I see with a lot of young people is that they go from, my parents don't agree with me, so I become rude, I become loud. I think by being loud and rude, my parents will start agreeing with me. I think by fighting with them, instead of talking to them, they will agree with me. Keeping in mind, talking to them also sometimes doesn't work. But one of the ways that starts the process is changing the way you sound, surprising them by being logical, by being calm. No matter what they say, don't get upset. Okay, use logical arguments. They may not agree with you, and when they don't agree with you, you walk away from that discussion. And then you go back to the easiest discussion of lying and doing whatever you want behind your parents' back and getting away with it, because that's another way of doing it. But you've already talked to them about it. Okay, I'm not kidding here. I mean, however, whatever works at the end of the day is different from what you need to do for long-term change. The first process of long-term change is you need to talk to them differently. The second one, which is more critical in a way, is to back it up by being responsible for yourself. If you come and tell me, doctor, my parents, they control my life. Okay, okay, wonderful. So who wakes you up in the morning? My mother. Who cooks for you? My mother. Who takes you to college? My father. Ah, and you're complaining your parents control your life. You control your parents' life, okay? You want it. You want your parent, you want to behave like a child and be treated like an adult. So here's the thing. Take responsibility for yourself. And sooner or later, they are going to have to take you seriously, because suddenly they're going to realize that you haven't asked them for anything. That you no longer need to ask them how to do stuff, where to do stuff, when to do stuff. And when they realize that, you don't need their advice, you're not asking their permission, you are telling them because you've already done it, you've already planned it, you've already doing it. You're just asking them for their advice in terms of knowledge. You're just asking for their opinion, not their advice. Then it starts to change. But if you act like that 5-year-old, God bless you lah. Continue. It's easy. Mommy will cook for you, right? Iron the clothes also mommy will do. Don't know how to work the iron. Papa will change the tires. Correct or not?
Right, doctor.
Hey, as your age, like, hey, it took me a while to grow up as well. Don't worry about it. It'll come. Just you have to make the decision to grow up.
Okay, thank you, doctor. Okay, so as what doctor has said, right? So your parents can have high expectation. Just something I would like to share. So parents can have high expectations out of you. For example, me myself, my own personal experience as a medical student, okay, let's leave out studies before medical came in. Okay, so when I entered medical school, I faced a lot of struggles where because of the syllabus, which was way different from SPM from foundation. So that's when I actually I actually thought that oh my god, I am actually becoming stupid. Okay, so that's how hard medical school is. I'm not saying just medical school, whatever course that you are in, you know how hard it is. Okay, until someone else is in your shoes, they wouldn't be able to feel what you're going through. So I would just like to say something that I started practicing since back then. It is always you versus you, and it's not you versus others. Let the other person, let your colleague, let your batchmates score high marks. As long as you're satisfied, you're happy, you keep going. As long as you're doing better than how you were doing yesterday, keep going. So that's from my side. And okay, now Leanne, okay, so earlier you mentioned like few symptoms or signs that a person or a student who is facing depression would actually show, right? So from my experience, actually know someone who was facing depression back then, and the symptoms were totally the opposite. Instead of being sad, being not inactive, they were actually being extremely happy. So okay, so how would I say this? So this is depressional symptoms where you're being sad and all, and this is normal person. So instead of this, they were actually being the total opposite of it. They were being extra happy, they were being hyperactive, and somehow you knew something wasn't right with them. So is this normal as well, or would you not categorize this as a depressional student?
I'm not entirely sure if I can answer you correctly, but that does it doesn't fit into the depressive symptoms, but it does remind me of a manic episode. Yeah, so those are the symptoms of a manic episode where there is elevated mood. There is, there's it was an extreme sort of elevated mood, and it could mean that they're in denial of their depression, in a sense that they're unwilling to accept, like, oh, I don't feel like getting up in the morning, and instead I'm going to double and wake up, and I'm going to do basically double the energy to replace the depressive symptoms that they're feeling, and basically denying it, I think. Yeah.
I also feel like it's something Dr. A mentioned earlier, where she said that you might be lying to yourself, just so you don't, other people don't know. But the thing is, you are facing these things, right? Just because you ignore it or because you lie doesn't mean it's not there. It's still there. Yeah, that's what I think it is.
Sometimes positive psychology is a pain in the neck. And everybody tells you must be happy, there's something wrong with you being sad. So people pretend and over pretend that they're happy. Sometimes it's called high functioning depression. All right. And this, when people are acting, and it is acting, it's okay to act that as long as you recognize that there's a problem and I'm acting for other people, but then I manage the problem. The problem with people who crash is they're acting and then they're lying to themselves. If I act like I'm happy, I know I'm depressed. I know I'm depressed, so I'm going to act happy, but I recognize I'm depressed and I need to manage it by myself, then I get better. But if I lie to myself, I'm not depressed, I'm happy, and I'm going to be happy, and I'm going to be happy, and I'm going to be happy, I will burn out. Your mental facilities for keeping up the act will decrease because you're not getting support. You're depleting your resources without re-energizing. When you recognize there's a problem, you re-energize, and then you use those resources. But if you're denying you have a problem, what's happening is you're burning up your current resources until that is burnt up, and then you crash. So I've actually nothing against high functioning depression, because sometimes I've been in that category. I'm high functioning, I am feeling very depressed, but I'm high functioning at that point in time. But at the same time, what I do is I recognize that I'm feeling depressed. I recognize that my emotions are down. And when I'm not in front of other people, I am managing those emotions. I am going for therapy. Yes, I also go for therapy. I'm not shy to say it. Okay, I went through MH370. I've been through heck in my life, and sometimes I need help, and reaching out is never a problem. There's no difference between me going to a doctor than for me going and seeing a counselor or somebody within the counseling spectrum, because I know too many counselors. So you have to understand that you can be happy, you can do that, positive psychology and all that, but sometimes you need to recognize that negative space and give attention and care, and here's a word, kindness and compassion to yourself in that negative space. So be kind to yourself, be compassionate to yourself, while in front of others you're high functioning. If you can be kind to yourself, you'll find that it is easier to go into healing than if you're going to try to force and I have to be better, I must, you're so hard on yourself, because I'm supposed to be good, I'm supposed to be the best student, I have to prove my parents right, I have to do this, and you're so harsh on yourself. So just be kind and say, you know what, I'm doing my best, but I need some more. I need something. I need someone on my side. I need something to re-energize me. I need help. And if you can do that, then you protect yourself. And then your high functioning depression just becomes high functioning. You're no longer depressed. All right?
Just something I want to add on from what Dr. A said. My friend told me this once. Very similar, like a different analogy maybe. All right. So like what Dr. A mentioned about your mental facilities, right? So let's just say you have like 100 coins, right? So and every day when you go out, you with your friends or during class, you go out, you want to play, you want to exercise or go out for sports. Everyone thinks you're fine. You pretend to be normal. Everything seems fine, right? And every time you take part and you pretend, to lie, you lie to yourself, you lie to them. I'm fine. I'm having fun. I'm not facing any issues. Nothing wrong with me, right? You're spending these coins, and at the end of the day, when you're back and you're by yourself, that's when, like what Dr. A said, you crash, right? So that's why, again, Dr. A says, it's important to give attention and care to yourself, and acknowledge what you're facing, recognize it instead of just pretending and then later on just crashing and facing all these problems all at once.
Okay, thank you, Dr. A. Thank you, Rishan, and thank you, Leanne. So how I would like to put this into is like, it's like our immune system. Okay, so whenever you are given a new drug, your immune system reacts by surging up the levels, so you get high fever and all. But one thing that's different here is that what your immune system is doing for you is a good thing, but what you're doing for yourself when you're facing depression by elevating your happiness or your mood is not good. So it's safe to acknowledge it and to reach out for help for any counseling services possible. So, okay, Leanne, all right, so as a student yourself, right, can you let me know, or can you let us know, like, how has the pandemic affected students' mental health? So your point of view.
Okay, so from my perspective, I think in my head, I broke it down into two very different ways students have reacted to online studies. Number one is being very overworked. Number two, being very detached. Those two are very polarizing things, but I'll explain why. And the third one, I think I would add, is that a very weird combination of those two, which can be absolute hell for students. So what I mean by being overworked is that because our entire university life is condensed onto our laptop, our room, our study room, our bedroom, and this is where we study. This is where we do assignments. This is where we have classes, online lectures, and all that. So we're conditioned to think that this is where we're supposed to study. So we spend the whole day at home because we can't go out, right? So we're stuck at home thinking that I need to be working because I'm at my desk. This is where I study all the time. And the minute you're not working, you don't feel productive, and you don't feel like you deserve rest until you are productive. So this sort of vicious cycle sort of leads us to feeling like we're overworked. in a sense. And as for detached, it's the same concept, but the other way around, because same thing, it's all condensed onto our laptop. The minute we turn off our laptop and we're not going to campus, it's almost as if we don't have a university life. We don't have a campus life. It's non-existent. And then the whole idea of us not going to class is this: it doesn't draw a physical border, or it doesn't create this boundary between us, our own life, and our campus life, our academic life. And it becomes very difficult to separate the two of them, I think, at least. And it also really brings up the sense of loneliness I want to mention here, because we're so separated from our friends. We can't really meet them and all that. That brings up loneliness. And one more thing I would like to mention also is that students, as we like to compare ourselves to others, as mentioned before. I know it is important that we look at ourselves, but sometimes we can't help it and we find ourselves comparing ourselves to others. But the thing about online class is that it's a very skewed vision of what we see of others. You only see them talk one time in class, or what they say in class, and then you compare, like, oh, they're so good at this and I haven't done this, and it really the stress from comparison and the pressure from comparison would really add to the weight of struggling with online classes, adapting to new classes and all that. And it really just adds on to the overall weight a student would have to carry during a pandemic. Yeah.
Something from your side? Thank you, Leanne.
Yeah, Elaine mentioned a lot of good points. All right, students being overworked, detached, stuck at home, and all that. I want to mention some specific examples of how the students, how us students, right? Many of us here are students in this forum, right? So these are some specific examples of how we are affected. And some of the things are like what Leanne said: you're stuck at home, and you can't go out, you can't see your friends. And for some people, especially those people who are social, for you it's a huge change. So that's gonna put you down a bit, right? And from personal experience, for me, every time I'm stressed myself, right, I would like to go out and play futsal, because it just helps me get my mind off things, right? But right now in the situation, it really can't. So instead of doing that, I just sit at home and just overthink my problems, right? And I'm pretty sure this happens to a lot of other people, right? This is why the pandemic has caused such problem, right? Apart from that, you have problems where some students have been working part-time jobs, right? And when the pandemic hit, some of them have been dropped, and this also adds to on top of your problems, on top of like not being able to go out, you have to stay stuck at home. Now you're being dropped from your part-time job. It's more of a burden, right? And there's some of us worrying about our parents, because so many of them have been facing financial struggles, and that will also cause us to worry about these things. And on top of all these things, you have some students where you put so much effort into the work you do, and for example, right, medical students, right, we study 5 years, and then you're excited for graduation, and then these events are canceled. That's going to put you down too, all right? And after your graduations are cancelled, once you're graduated, you want to go out and look for a job. It's going to be hard, because it's a tough time out there, right? Not everyone's going to be accepting. It's going to be difficult to land a job, right? And for those that are staying far away from their families or close friends, right, for maybe those studying, coming from overseas and all, right, they're far from their loved ones, far from home. And if the cases, the pandemic, the situation in your country is bad, or in your state is bad, you would definitely worry about these things, and there's nothing you can do about it. So it's going to put you down as well, right? And one setback, for example, for us medical students, I mean, Kirti, I guess you would understand, like we're not able to go to the hospitals anymore, and the learning situation has changed for us. So we have to adapt, and we have to keep adapting every time. Every time, they change as EMCOs now. There's so many MCOs, right? So you have to keep adapting and adapting. You get tired of all these things, and that's what's putting us down, in my opinion. This specific examples.
Okay, something that I would like to share as well. So aside from the educational thing, right, when it comes to extracurricular activities that we usually have on campus, like what Rishan said, usually he plays futsal and all. So for myself, I actually work out. So the first week when we had lockdown, I was very enthusiastic about it. I was very excited about it. So okay, so we are gonna do home workout and all. So that actually didn't even last for a day or two, because at the end of the day, I was like, actually, why am I doing this? I do not have any friends to motivate me. So end of the day, when it comes to like around 5-6 p.m., I just end up sleeping. And then I wake up, I have my dinner, I come back to my room. So basically my room is where I live in instead of the house as a whole. So I'm pretty sure this is what most of the students are facing now. So okay, so Dr. A, when it comes to students being depressed, right, there are complications that can actually arise. So let me just state out a few. One would be substance abuse, recreational drug usage, alcohol abuse, as well as the one that tops the list is suicide. So how would you actually approach students with these thoughts, suicidal thoughts, or who are already into the substance abuse and all? Your experience, doctor.
Okay, when it comes to suicide, are you asking me about the individual or asking me about supporting the individual? Because you packed a lot into your sentence just now.
Okay, maybe you can actually let us know about both of them as well, doctor.
Look, if you are feeling suicidal and your reason is because of university and school, we had a suicide talk earlier. 1 hour. We had a 1 hour session. Evan was there, and Chai was there, in fact, and we talked about suicide. And when we talk about suicide, one of the things is that you are, especially if it's about your grades, you are using a permanent solution for an impermanent problem. Telling yourself that's permanent. The problem is impermanent. The problem is something that can be overcome with relative ease. If you're not suited for a certain course, there may be other courses. If you're in a certain situation, that can change. If you're in a relationship, I've had people who are suicidal because of relationships. 6 months later, if they get the help and all that they need, they're dating somebody else, they're fine. But if their earlier solution had been fulfilled, they would be dead. Okay, yes, there are people who have got, suicidal ideation that's continuous, that is much more serious, that there are traumas in their childhood, and the suicidal cause is something from the past and it's very serious. In those cases, reach out, get support, because your life is worth it. One of the problems that a lot of people who have suicide ideation is they feel they're not enough. And here's the truth. You are enough. You don't need to do more. You don't need to be more. You don't need to love more. You don't need to achieve more. You are enough. And if you can even start to believe that, then you will become who you need to be in your own life. That is suicide for yourself. Now, for those people who are witnessing people, or you're in a situation like right now, everybody is in crisis. Number one, stop watching real videos of people killing themselves, and for God's sakes, don't forward it. If I wanted to watch a picture of somebody of the guy on the bridge being suicided, of killing himself, I can Google it. My frame of mind is I'm expecting to see it. But when you surprise somebody by forwarding them in a text from a friend, all I'm seeing is I'm getting a video from my friend. I'm in a relaxed mood. I'm in a good mood. Okay, I'm in a nice place. And then I open the WhatsApp message, and what do I see? This person hanging from the bridge. Gone lah. My brain is gone. My expectations are gone. Stop doing that. You are traumatizing other people. Vicarious traumatization is a real thing. For goodness sake, stop forwarding this nonsense. Ask your friends, if I have this picture, if you want to see, I'll show you. At least give them a chance to be mentally prepared, because it's a totally different thing. And medical students should know this. If you are sitting down there and cutting up and you are going into a surgery and you're cutting somebody up, your brain is in a different space. If I'm holding a knife there and I accidentally cut somebody and suddenly blood is splurting everywhere, I'm not in a, my mental reaction to that is totally different from when I'm cutting somebody in a medical space. It is the expectation of what you're seeing. When I watch something, and I have watched some pretty horrifying videos because I needed to see it in order to talk to the victims, my brain is in, I'm on call, I'm a counselor, I'm on duty. But when I see it, when I'm relaxing, I can feel the trauma. I can feel that I'm in a different place and I wasn't expecting it and I was surprised. So one of the things all of y'all can do right now is stop forwarding this nonsense without warning your friends, without warning your family, because this is not funny. This is trauma. This is real. Everybody watching that knows this is not something that, Hollywood made up, and it's different. So get that through, okay, that it is different. So when you're talking about suicide, one thing everybody can do is that right now in Malaysia. And the other one is, we are there for people, but we also care for ourselves. There's a limit for what people, that you can give people when they're in suicide. Give your presence. But if your presence is not enough, you have to encourage them to go for professional help. And if they don't go for professional help, if you are burning up your resources supporting somebody, you have to know when to step back. Because two people suicidal does not help anybody. All right? So that's what I can say about this.
Okay, thank you, Dr. A. Okay, so, all right, Rishan, as a whole, right, how would you actually approach a family member or a friend and look after them when you know that they are facing depression?
Okay, honestly, Dr. A already covered most of the points. Most of the points she just gave us solid points, right? Like even the last point she said, if your presence is not enough, then it's better that you get information about like the services available in because we're in Malaysia, so not all of these things are readily available, and it's not something that's always publicized, right? So if you do a research, you can definitely find these services, right? And you have to let them know that you are not good enough to help them out, so they need to seek for professional help, right? And of course, like I mentioned earlier, you have to like go about this the right way, never to force it upon them, all right? Make sure that they're ready, and you have to keep encouraging them, all right? There's services like counseling. You can see a therapist, you can go for support groups, and from your side you can always stay in touch, make sure they're all right, whether it's you go and see them physically or through messaging, texting, right? Just checking on them is very important, right? Make sure they're fine, and also make sure that they're honest with you, right? Because that's the only way to keep up with them, right? And that's how I think I would approach if anyone on my side, I know, right, is going through such things.
Can I add on a few points on Rishan?
Sure. Go ahead.
All right, so I think it's also very important to note that we should never undermine or invalidate when someone comes to you with a problem. So don't try to tell them, oh, you're just sad. Don't say that. Don't try to invalidate what they're feeling, and always, like Dr. A said, be kind to them. Yeah.
Thank you, Leanne. Okay, just to add on, right? So in short, I would like to quote something that my senior, he's in 5th year medical school, he's gonna graduate soon. He actually told me the very first day I entered medical school. You do not treat the patient, you do not look at them as a set of symptoms or signs, you look at them as a human as a whole. So you treat them as a human instead of treating the symptoms and the signs that they present with. So same goes to depression. you do not treat what they are coming up with. For example, they do not have mood to do this, you do not treat that, but you treat them as a whole, as your friend, as your family member. You look up upon to every single person who's facing depression as your own loved one. So yeah. Okay, all right, Dr. Anasuya, I would like to ask something which I'm curious about. Is
Sure.
is suicide contagious? Because from what I've experienced, if I okay from my radius for where I live or where I study, if I ever hear of someone who has committed suicide recently, there's always one or two cases that follow the recent suicide case. So anything, doctor? Yes.
I'm gonna say this. One of the biggest things which I do when people come and tell me I'm suicidal, if I kill myself, I'll make the world a better place. The answer is no, you won't. No matter, suicide has never made the world a better place, because you're absolutely right. When one person suicides and people watch it, people have bore witness to it, everybody who watches or witnesses or has to clean up or has to deal with the situation is traumatized. So so all those people have been traumatized, and the family members who are left behind are also traumatized. Their lives never get easier. I am speaking from experience on this one, from somebody who has had a family member suicide. No matter what dialogue you're telling yourself, if you are saying, if I'm going to kill myself, I will make the world a better place, you are wrong. All you're going to do is increase the pain in the world. You're going to increase the trauma in the world. You're going to increase all the negativity in the world. So if your purpose is to reduce the pain, then learn how to manage the pain. Learn how to live with it and change your situation. It's not easy. None of the stuff I've said in order to manage stuff is easy. It is hard. But trust me, if you're going to say that I'm doing this for other people, it's a lie. Because really, suicide it is contagious. Because it creates more trauma, it creates more traumatic experiences. Everybody who loved you is traumatized. Everybody who saw, they don't love you, they don't know who you are, but they saw it, they were there, is traumatized. And so you have exponentially increased the pain in the world. So that is the one lie I will challenge. I will challenge that lie because it's a lie. I have lived through it and I know it. When you look at statistics, because some people, Dr. Anasu is only talking about her experience. Okay, fine. When you look at statistics, in a family where there has been a successful suicide, the likelihood of another suicide being completed is increased 17%. That is significant. So there's a significant increase in your family of suicide once you've had one completed suicide in a family. So don't give me that nonsense about it makes the world a better place, it makes my family a better place. That is a rhetoric that is just not true. You want to make the world a better place, let people help you heal. Then you make the world a better place. Accept the hands that reach out to you to help you. Then you make the world a better place. Okay? Because you're not only helping yourself when you reach out and accept the hand, you're helping the person who's reaching out. That's what I can say.
I agree with you, doctor. Thank you. And okay, Leanne, why is mental health a taboo in Malaysia?
Okay, I'm going to give my perspective on this as someone who grew up in Malaysia in a fairly conservative household. Let me start with an example. When I first applied to study psychology as my major, I was told by the time I graduate, I'm going to have depression. That was what I was told. And I think there's still, it was one of my family members, and I think they're still pretty keen on that idea. So that I think serves as a pretty good example. But I think I boiled it down to three things that could lead to the cause of the taboo, which is number one, how kids are raised, how their parents influence them, how their peers and siblings influence them. Second one is what schools teach, or better said, what schools didn't teach us. And the last one, which I'm not that familiar with, is how mental health is viewed in workplaces. And usually it's fairly negative. And all these 3 points, I think, boil down to just a simple fact that people aren't educated enough on mental health as a whole. People don't understand it. So let me tell you, for example, this person is going to therapy for the sole purpose of wanting to achieve a goal. They want to achieve a goal in their life. They need extra support. They go to therapy. Going to therapy does not necessarily mean it's a negative thing. And what Malaysians do, I'm generalizing here. Don't don't specialize it to one person. But I'm generalizing here that they sort of put mental health under this huge umbrella of crazy. That if you're going to therapy, you're crazy. If you have depression, you're crazy. They equate everything to being crazy, and it's just sort of this stereotype that's lived on for ages, right? So let me give you an analogy. Let's link it back to physical health, actually. So if someone broke their leg, they go to the hospital, they get it treated, their friends, family are supportive, they give them physical support, they bring them to the hospital, they give them emotional support, they sign on their cast for all I care, right? And then, the patient gets enough support and emotional support most of the time, right? But if we were to view that same situation in the lens of mental health, so how people view mental health as a whole, it would go something like this. The person breaks his or her leg, goes to the hospital, gets it treated, comes back out. And people will start, instead of giving support, the people around that person will probably be like, the reason why you broke your leg is because you're incompetent as a person. They would say, they would be faced with judgment and not support. They would say things like, get over it, it's just a broken leg. They would say things like that. Or, other people have it worse. Other people actually don't have their leg. And they would say, oh, go back home. You don't need to go to the hospital. Just go home, drink some warm water, you'll be fine. It'll heal itself. It's crazy if you think of it that way in terms of physical health, but that's what we're doing to mental health. We're dismissing it as if it's not something that we live with every single day. And it's as if it's not something just as important as our physical health. So people need to understand that, someone with a psychological disorder, it's not crazy, it's not dangerous. It's just something that we have to learn to live with as a nation, right? And mental health in Malaysia is not looking that great for now. I think most of us would know that. And I think, we all have to start somewhere. Yeah.
Thank you, Leanne. Anything from you, Rishan, about this?
I agree from Leanne that when she said, we're not educated enough about mental health. I know there's a lot of webinars or talks. It's always held, right, in universities and all that about spreading awareness, right? But I don't think we're reaching out to many people, but we're also not reaching out to many others who don't know what they're facing, right? So it's important that it's not a very spoken topic, because Leanne said, it's a very negative view, right? So when people say, I'm going for therapy, they think you're crazy, they think something's wrong with your mind, they think you're weak, and all these things. So it's important that we change the views of these people. And again, back to spreading awareness, right? I think we are doing what we're supposed to, but we're not doing enough. That's is what I think is the problem.
Okay, thank you, Rishan. So I agree with what both of you have mentioned. Okay, so Leanne, right? Earlier you mentioned that there are people who outside there, they actually classify you or categorize you. Okay, say for example, you entered psychology and they're like, okay, at the end of the course, you're gonna be facing depression. Okay. This, I'm sure that this is not something that only you have faced or students from psychology course have faced. Students from medical course face this, students from business course face this, architecture, name it. It's the society, or how would I say this? For example, the people around us, it is created by us. Okay, so we ourselves, our family, our relatives, then the society. So from where I'm coming from, I can actually relate a lot to my relatives, I would say, as a society. So, whenever you have something, they will be like, there are some people doing better than you, so why can't you be as competent as them? Or, okay, the most common phrase that I've heard till date is, why are you doing medicine? Medicine is a hard course. By the time you come out after graduating, you're going to be 60 years old, you're going to be 70 years old, no girl's going to marry you. So this is what I have heard a lot of times from my relatives as well as the society. So to simplify it, right, we can't actually sit back and let the others do their work and let the society to change. We ourselves, we are going to be growing up into an adult, or we are actually young adults now. We are going to be the society. We are the society now. So what we have to do is we have to make the change. It's up to us. So I think that's from my side. Before actually we end the sharing session, I would like to ask if any speakers over here, Dr. A, Rishan, Leanne, you have anything to add on to anything in general about our topic today?
Nothing to add on, but just to highlight whatever Dr. A said, like some really important points or quotes, things people should understand, like, don't let your emotions be in charge. Instead, you take charge. And I think this is very important because I've seen and heard many people struggle with the same issues, right? It's important for you to always uh, have these things under control, right? You take charge, right? Give attention to yourself, acknowledge what you're facing instead of just pushing it aside, right? Because you can keep pushing it aside, eventually it's gonna just keep piling. It doesn't leave, right? It's still there, right? And another point you mentioned is everyone should know this is that your life is worth it. You are enough, right? Keep telling yourself that, and also accept the hands that reach out to you because we're trying to help. There's a lot of people out there trying to help, and it starts with you. You gotta make the first step, right? You reach out our hands, you take our hands. It's important, all right? Nothing else to add.
Sorry. Yeah, I just wanted to say, back to the topic of this entire forum, right? For all the students who are watching today, right now, like Dr. A said, if you feel like you're struggling and you need the extra support, do not be afraid to reach out for help. There's really nothing wrong with it. In fact, it benefits you in more ways than you can imagine. So please don't be afraid of it. Get help if you need to. Yeah.
Dr. A?
So we're at the end of the session, right?
Yup, we'll be having a
Okay.
Q&A session after this.
Oh, a Q&A session after this. Okay. It's okay. I mean, we're in Taylor's University. We have FNB and all that as part of Taylor's University. So this is the last thing I want to say. Be kind to yourself. Enjoy life. Don't go to extremes. Okay. Some people talk about, just now we talked about, getting over drunk, getting too much involved in alcohol. That's definitely bad. But once in a while on Saturday night, when you have to sit through talks like this, having a glass of wine here and there, not that bad. Learn your limits of relaxation. Be kind to yourself. Being kind to yourself doesn't mean self-indulge. It means find a balance where you can enjoy and you can live your life. And if you're a medical student, never mind lah. You can enjoy after you get your degree. I know it's the wrong information to tell medical students to enjoy because you all chose medical. So good luck. Okay. But once you're finished, then keep it in mind. Once I'm finished, then I can enjoy. Once you're finished, then you can enjoy. So keep that in mind. For the rest of us, we find the balance. For psychology students and all that, find the balance in what you do, find the balance in how you manage, and then you can balance off the depression. Be kind to yourself, be compassionate to yourself, and if you need to because you've made mistakes, forgive. Forgive not other people. Sometimes you don't have to forgive other people, especially if there's abuse. You don't have to forgive abuse, but you have to forgive yourself for being loving enough, for being kind enough, for being naive enough, and allowing the abuse. Okay? So it's not blaming yourself for it, but it's forgiving yourself for it. There's a difference. So that would be what I want to say. Thank you.
Thank you, Dr. A. Okay, so right now, Cohen will be sharing the screen to let us see the questions that have been asked by our audience over here, and we'll be answering them. So, Dr. A, Rishan, Leanne, you can just go on and answer. So I won't be directing it to anyone specifically. If you want to answer, you can just go ahead. Yeah. Okay. So Cohen, you can share screen. Thank you. Okay. So all right. So the first question over here we've got why are medical students not allowed to sign up as a peer counselor? I think this is directed to Mr. Evan, or is it? Okay. Okay. I think we'll move on to the next question. So the rates of LGBTQ community are experiencing depression is more than heterosexuals. So how can they seek treatment when LGBTQ is illegal in Malaysia?
You can seek treatment. Counselors do not go and the counseling field protects you because number one, it is private and confidential. Being LGBTQ is not considered hurting yourself or other people. So those are grounds where you can break confidentiality. It is not a ground where you're supposed to break confidentiality. That being said, test and choose your counselors because sometimes counselors are idiots. Sometimes school counselors, and I'm going to be honest, okay? Sometimes counselors are absolutely evil, and I know counselors who have outed their students. So be very careful about who you choose. Do a little bit of research. Shop around. Go for a first session. Don't tell them the real issue. Lie. Tell them, just see how they react. See whether they are genuinely there for you, or are they just doing a job, or are they bluffing? Because, like they're humans, so you're going to get the whole range of it. And if you feel they're genuinely there for you, then share. But take up, be a bit careful when you approach it. There are a lot of counselors out there who are willing to support. There's PT Foundation, which has a counseling center for people who are there. And there are lots of other different resources. I think people are posting in the chat some of the resources that you can approach to seek counseling. I am going to tell you all, I am one of the advisors for setting up a transgender clinic in Malaysia. I was sat on the committee that actually is looking at setting up one of those centers in Malaysia, the first of its kind actually, transgender center. I'm unfortunately, because MCO is coming, MCO is a okay, never mind. A few words for MCO, but we can't say that when it's being recorded. But it's delayed. It's delayed the rollout of it, but it is with Seed Foundation in Malaysia, if you all know Seed, and they are going to set it up. So legal, illegal, whatever, the human impetus, the human desire to create an equal society and a human society is there. And there are places that you can find support. LGBTQ community, members of that, if you think you're a member, just be careful and do your research. Just because they have a title of counselor doesn't mean you automatically trust them. Go for a session, go for 1 or 2 sessions, test the water, see if they're idiots or real counselors. If they're idiots, change counselor, go shopping. If they're real counselors, then go and see a counselor. Then you talk to them. Okay? I hope that is helpful. Thank you.
Thank you, Dr. A. Okay, so the next question that we have over here is how do you advise someone who went to a psychiatrist and got a diagnosis, but uses the diagnosis as an excuse for their underperformance in life?
I wouldn't advise someone because they wouldn't be dumb enough to come and talk to me. So anybody who's doing this knows very well that I would catch them out and they would avoid me like the plague. So I'm going to let the other two answer this question.
Leanne, you want to go first, Leanne?
Okay. Tricky question. What got a diagnosis with underperformance in life? I think it's important to communicate that recognizing your diagnosis is something very important, but it doesn't serve as an excuse to not continue working on yourself. It's a very fine line between um, it's a very fine line between knowing your limits and also pushing yourself to get better in a way. I'm struggling to find the words here, I'm sorry. But I guess in a way you can tell them that your diagnosis does not define you as a person. It is not, it doesn't, you shouldn't let it become a label on yourself that this is all I am now. Your diagnosis, this is my diagnosis, is all I am now. That's why I am letting go, and this is why I'm not performing well in my life. Instead, it should be something you acknowledge that is part of you. But you know, you're not necessarily a problem, it's just a problem you have to deal with along the way.
I think
Yeah.
summarize what Leanne just said. If just because you have, example, a disease, right, diabetes, it doesn't make you less of a person. Same goes to if you have a mental illness, right? If you're suffering with depression, it does not make you less of a person, right? You are as good as everyone else. So don't bring yourself down, right? So always move forward and only forward.
Okay, thank you, Leanne. Thank you, Rishan. So once again, this question I would actually direct it to you both. How can you convince as a student to a friend of yours who is severely depressed to seek help, especially if you know that they are at the verge of committing suicide?
I think I can answer this one first. I have this sort of experience where I have a friend who was depressed, and it took so much convincing to get them to get help. But the one thing that really worked, from what I remember, was that I went to get therapy. I went to get help because I was also struggling with my anxiety and all that. And I was like, you know what? If you're so afraid, I'm going to do it first. I'm going to go ahead and show you that it's nothing too bad. You know, all your information is kept confidential. You know, it's a safe space if you go to the right place. You know, like Dr. A said, don't go and I hope you don't run into an idiot counselor, in her words. And you know, what worked for me was that I took the first step. I showed that therapy isn't something to be afraid of. Isn't something that would harm you. In fact, if you do it correctly, if you find the right people and get the right support, it's honestly more beneficial than you would imagine. Yeah. Rishan, you want to add on?
Yeah, I mean, you gave a good answer. So right, I know some people only be comfortable speaking to like a certain people. So if it's your friend, they will be comfortable only speaking to you. And when if you advise them and encourage them to go seek for professional help like a counselor, therapist, they might just say like why do I need to like go to them and I can just talk to you. My problems are solved. But the truth is, we are not professionals. We're your friends. We're there to support you, but we can only do so much. All right. And just like Leanne said, we have to like lead by example. So if they are not so willing to seek for professional help, we can sometimes, to be supportive, we can go with them, accompany them, because it'll make them feel more comfortable, right? With your presence, right? These are some ways you can help them, right? Approach the problem together if they're afraid to face it alone, right? Yeah, that's what I had to say.
Yeah, and also just to add on, it's important to remember you can't make someone go to therapy. You can't force them to go. If ultimately they don't want to go, it's up to them. So just keep that in mind.
Okay, Dr. A, based on your experience, depression is a trend among the younger generation. They like to be associated with mental health disorder. How do we know that whether they are truly affected or not?
Wow, so much judgments in that sentence. It's a trend among the younger generation. What? Who's asking the question? A boomer? Excuse me. It's a trend among the young. For goodness sake, the judgments in that question is ridiculous. They like to be associated with mental health disorder. What? Can you please provide evidence of these allegations? Because I don't find that to be true. All right. I think this is the absolute nonsense you get from boomer communities to the younger generations. And if you all buy into it, and if this is from a millennial who's judging yourselves based on the stupid ass things that older people say, Oh my God, is that recorded? Still recording. Okay, sorry for that. Okay, apologies for the choice of words. But, you know, you all are being affected by an idea that is false. You are if you actually look at stats, the reporting is higher, but the actual number of incidents is about the same. But people are more willing to come forward. Your generation is actually more willing to look for help, which the older generation, which kind of messed up the whole world in more ways than one, okay, and then they're blaming you guys. Come on. All right, this whole question is just wrong. It is judgmental. It's based on a false premise, and and if you buy into it, then you're affected. If you are going to go that, our generation, we're no different from any other generation. The only difference is we ask for help. And in the fact that the older people, they created the stigma, they created the problems, they created all this, the idiotic ideas that mental health is bad, and your generation has to live with it, and your generation is breaking that stigma. Can you please tell them where they should put those ideas and get help? Do what you all need to do to be happy. That's what I say. Thank you.
Okay. Okay. So a question that has arisen in the chat box: does an illness cause depression or depression cause an illness? Okay. I agree with Kathleen over here, and actually they go both ways. Where first I would talk about how depression cause an illness. So for example, right, you're being depressed, you're not going to be eating, you're not going to be yourself. It can lead to you having anorexia nervosa, and in long run it's going to be leading you into having ulcers, gastritis, peptic ulcers, and stuff like that. Okay, how does an illness cause a depression? Okay, so for example, you have a lump in a part of your body which is a lump and it is not cancerous, but based on your research that you've done by using Mr. Google over here and the technologies over here, and as well as the society's perceptions on that, they take it as cancer without even checking with the doctor. You get to know that it's you think that it's cancerous. So this can actually lead to you having depression in the short run, as well as if you do not consult the doctor or a professional medication provider, you would actually end up in depression as well. So it goes both ways. All right. Yes.
Before, no, this one is a bit serious, especially for sudden changes in behavior. Sometimes people go and see a counselor or a psychologist when they should be seeing a medical doctor first. So I'm going to say this, and I have actually done this before. And I know I frighten parents when I've done this, especially with young people, and they're quite young, and they have a sudden change in behavior that is not normal of adolescent changes. So that can indicate that there are early symptoms of something wrong with the endocrine system, something wrong with the brain. And one of the things that all psychologists and counselors need to start looking at and need to start recognizing is that, when you take out trauma, sometimes what you need to take away first is that the sudden change in behavior can be physiological. It can be something that they need to see a doctor, because tumors in the brain, one of the first signs of tumors in the brain can be an inability to control your temper, a change in your temperament, a change in your behavior. And the actual change in behavior is an early sign of that, that you're going to have a tumor in the brain. So if you can catch it at that stage, you can probably treat it. So I'm actually going to say, I'm just going to add to what Kirti said, but a little bit more seriously to the psychology students here, that, sometimes, especially when people are saying that the behavior was very sudden, but there was no accident, there was no this, there's no that, you really have to, sometimes have a very, and I've had it more than once, it's one of the harder discussions I have with especially parents, telling them that, look, before you come and see me, I want you to see an endocrinologist, or I want you to see a cardiologist, or I want you to see, I forgot the name of the doctor who deals with cancer. And I've had parents cry, and it gets, 8 times out of 10, it turns out to be nothing. But 1 or 2 cases, it was an early catch on a tumor. And that's good enough for me to keep doing it. To keep panicking some parents, if I can at least 1 or 2 parents can actually go and stop it from happening. So, I mean, I understand that the body and the mind are connected. So sometimes what comes out in your personality is because your body is affected. So yeah, that is a very serious question. And I thank you for asking the question.
Thank you, Dr. A. Okay, what if you want to go for counseling, but you have no money for it? Anyone would like to go? But then,
CCS is free lah.
Rebecca.
Go lah, CCS. You all are students. Okay, counseling is free in Taylor's. What? You know money, don't need money. Just you need time. Go. Okay.
Okay, so I'm pretty sure other universities, they provide a counseling service as well. So instead of actually going further mile, going outside of the university, you can actually go for the ones in your universities as well. And there's a link provided by Kathleen in the chat box. You may as well check that. Okay, so why depression doesn't exist many years ago?
Because people who are running for their lives have no time to be depressed. People who, if they've got no food at home, if they don't work, they don't eat, have to get up. Remember what I said in the first, your behavior can become depression. So when your behavior supports depression, you're going to get depression. This question is serious because when you look at ancient languages, the word depression starts coming in the Greek times. In the Greek times is a time of opulence, when people have a lot of free time and a lot of excess wealth and a lot of excess. So when people have a lot of excess time on their hands, they have time to sit down and overthink. They have time to sit down and indulge in thought. Whereas when somebody has to go to sea and you have to go fishing and you're fighting, you got no time to think. When you're at war, you got no time to think. If you think about it, how come people can be in Bosnia Herzegovina, can be in war-torn countries, can run away from their countries? They are, you'd expect every single refugee to be depressed, but they're not, because they didn't have time for it. So unfortunately, I'm going to say that depression, yeah, he's right. It didn't exist many years ago. I'm talking about centuries ago. It is a modern disease where when you're depressed, all you have to do is pick up the phone and call Pizza Hut. If you can't do that and you have to actually get out of bed and move, chances are you're going to reduce the depression because you're forced to engage. You're forced to do the things that actually reduce depression. So that's where it comes in. Okay, and of course it's not 100%. There may have been some individuals who had major depressive disorder because that would have been a mental sickness, but the behavior earlier, that would have been reduced. Okay.
Thank you, Dr. A. I think what Kathleen has mentioned in the chat box, suicide cases are surprisingly higher statistically in rich people, relates back to what Dr. A has mentioned. Okay, so the next one, what should we do if a friend of ours is depressed and is only comfortable to speak to you and no one else, but then at the same time you yourself are not mentally stable at the moment? How would you tackle this situation? Rishan?
Well, again, if you yourself are not in the right state, it's not really best thing to do to help someone else. All right. I'm not saying you shouldn't. All right. Of course, the people you care about need support from you, but you also have to always remind yourself to take care of yourself. Right. And maybe again, maybe you all can approach these problems together. Like what I mentioned earlier, maybe you can start going for therapy or counseling together. All right. And uh, it's always important for you to look after yourself. That's one thing everyone needs to know, right? You can always go around saying like, it's okay. I'm the type that needs to help other people. I can think about myself later on, but that's not a good way of thinking. So as you're helping the other person, always remind to give some time to yourself, and you need to be open with your friend as well. Like you're not so well yourself, so the both of you can actually connect and maybe help each other out.
Can I add on?
Yes.
So I think it's important to remember that you are not responsible for your friend's mental health. You are not their therapist. You don't have to feel like you have to take on the responsibility if they were to come to you with their problem if you are not well yourself. So I think it's very important to remember that.
I'll give you another easy way of doing it. Number one, go for counseling with the person. Take them to the center physically. Physically go with them, physically take them, physically call and say, look, I can be with you, but then you have to walk yourself because it's your life and I have to live my life. But I will go with you to the center, and then I'll go as far as I can. And that's the best you can. Okay? Is mental health caused by ghosts? There are 6 likes to that question. Oh, I'm going to ask the other two to answer first before I go into it because it's late enough for me to do ghost stories, right? Let the other two answer first, then I'll take it. We have to answer it. It's got the most likes. Can't ignore it.
It could cause depression because it could be considered as trauma, right? It could be considered as trauma, so it could lead.
Ghost is trauma. I want to watch them squirm when they answer this one.
Because some I mean people get scared like you see something supernatural. I don't think some people get excited, I guess, but some people will definitely be scared, even though people nowadays act like I don't believe in this, I don't believe in that. But if you see something supernatural, you're going to be afraid, and if it's something very traumatic, it's going to keep reoccurring to you, and that might lead to changes in your being.
Okay. Tanjung Rambutan vibes.
I was gonna actually say something, but Rishan already took my answer. You took the words out of my mouth. That the trauma, maybe. I'm actually not sure. This question really threw me off. I'm sorry.
Right. Okay, you're in Malaysia. There's ghosts. Why did we never learn about ghosts in psychology? So Hannah, which of my classes did you attend? I think I did talk about it in some classes, but not in all. So too bad. Okay. Now let me say this. Y'all have all heard of placebo, and it goes with the question of can exorcism control ghosts. I'll give you a first scientific answer for all of it. There is always going to be a placebo effect. If somebody believes in something strong enough, can prayer uh, heal mental health? Can it heal? Yes, because you have a placebo effect. Placebo effect is a proven effect where faith, by some miracle, does heal people because people believe the mind can, but it's like a miracle. There's no way to guarantee a placebo effect. All right. So you're going to have some level where you're going to have certain numbers of people who will swear to it that their prayer, their God, their bomo, their dukun, their whatever, the guru, they cured them of a disease. And they will have physical evidence of it because that's what placebo is, that they were cured. All right, they will have physical evidence coming along with it. Now, whether you want to add that it was God or it was a ghost or it was a spirit or it was a jinn, it is up to your belief system to add. You know what? Nobody else can question it because why would you take away placebo from somebody? If somebody can be cured on faith alone, they don't have to put in so much money. Of course, that means the doctors and all here get less money. Okay, so maybe that's why you don't do it because you get less money. But placebo does work. It doesn't work for everybody. So for the community that it works for, scientifically, you have no reason to take it away from them. Okay, so that is a scientific, logical answer. 2, is mental health caused by ghosts and can it be exercised? Now, if you're going to ask me personally, do I believe that it can be caused by ghosts and can it be exercised? The answer is yes. Now, why would I say that? Because I've seen it happen. And that's all. But the numbers of it is very low. If you're talking about seeing over 200 cases in my life, or 300, more like 400 cases in my life, you're talking about 3 cases. Or 4 cases, actually, to be precise, 4 cases. Okay, so that is a really low number, really low percentage, not significant at all. Okay, but belief system, mhm. I mean, at least according to the whole story and all that, according to what you see in the room, oh yeah, it can be caused by ghosts. Okay, but then do I believe ghosts exist? Heck yes. Why? Because I've seen it. You can think I'm crazy, that's fine, it's okay. I mean, crazy in a lot of ways, and crazy good can be crazy. But it's my belief system, and it's a belief system I don't force down anybody's throat. It's a belief system that I stand by as in my experience, and my experience is not something you all need to share. But you need to respect it if I'm not shoving it down your throat. So understand the difference between the two, and there you go. That's the answer. And if you want the stories, you have to be in my classes. I'm not going to tell you all the stories now.
Okay. Thank you, doctor. And okay. So I saw a question earlier.
That was funny.
Um, will the demand for psychologists increase in the future?
Dr. A, are you going to answer or should I take this question?
Yes, lah. That's why I'm teaching it, right? If I'm not teaching it, then why would I? If I'm teaching a subject that it won't, why would I teach a subject where the demand will decrease? Why will the demand increase? The demand will increase because people stop talking to their bigger families. We have stopped having large family systems that support us. We are getting more and more individual. The problem with getting more and more individual is that you're getting more and more alone. The more alone you are, the more you need people to listen to you. And the more you're willing to pay people like me to listen to you. So I'm more than willing to take your money, and I'm more than willing to say, yes, numbers of clients are growing. There you go. See, simple. Come on lah, it's Saturday night, chill a bit lah, relax a bit lah. Everybody's so serious. Why am I the only person joking?
Okay. Okay. One last question. Okay, before we wrap up this session. How would I know if I'm depressed or just sad? I experience depressive episodes, stuck in a rut and unmotivated, but then I pick up myself and go on with life.
Leanne?
I was thinking of this question. I'm still thinking how to answer it. I guess if you really want to put a label on it, I guess you would like the periods where you do experience depressive episodes. It's just that point of time you're depressed, and if you're able to pick yourself up and go on, I think that's a good sign because you know what to do in order to get yourself back on your feet. So, in that sense, I think you're still able to juggle between, your short period of time of feeling depressed, but then you're still able to pick yourself back up in that sense.
Yeah, just to add on to what Leanne said, if you can pick yourself up, like Leanne said, it is a good sign. It's a good sign. But if you're worried about what you're going through, it's never a bad thing to see a professional or talk to someone about it, right? I mean, from the medical side, we have some tests like the PHQ-9 or and all this. So that's how you determine all this. But it's okay to always just seek for help, and then you'll get your answer, right? If you're always wondering if it's like a constant, if you're constantly in that state, in a sad state, but you don't know if you're depressed or just like temporarily sad, right? So you can always just get it checked out.
Okay. I think we can just yes, doctor.
Very quickly on why women are more likely to get depression. It's because when you have mental health issues, there are some gender specific, some which are non-gender specific. Because males sometimes have different ways of managing their negative feelings, so it can come out like more aggressive, or it can come out like narcissistic. Versus sometimes women, if they internalize the issues a lot, then it can become more like depression. So I think that it's not so much that men get more depression than women. I think that the way people manage their emotions, for women, it creates more depressive symptoms. For men, it may create more violent or may create more schizophrenic or other kinds of mental health issues. That's all. So it's actually quite equal between the emotional disturbance is equal between men and women. It is the management of it that's the issue.
Okay, thank you, Dr. A. Okay, so I would like to thank Dr. A, Rishan, and Leanne for their time. for their amazing thoughts as well as insightful opinions, experiences that they have shared with us today. So thank you to everyone present here for taking your time off and to be a part of the forum today. So one thing that I would like to say before I wrap up, right? So if you know that you're facing depression, or if you know of someone who's facing depression, one thing I would like to say, do not look out for the answers or the solution. Do not Google up the answers. Because personally, when something can be as small as gastritis or as small as an peptic ulcer, can actually lead to being a malignant disorder stated by Mr. Google. So seek out for professional help, proper ones, like what Dr. A has mentioned earlier. And technology is good, but only an individual would be able to understand other humans' emotions. So with that, I think I would end this session. And thank you for your time. Before you leave, you can just scan the QR code for our feedback form and leave a feedback there for our future forums. Thank you. Thank you, Dr. A. Thank you, Rishan, and thank you, Leanne.
Thank you, Doctor.
Somebody asked how to contact me after the session. I'm contactable via Office Taylor's email for all Taylor students. And yes, I'm one of those people that do see Taylor students during office hours for free. Note the choice of words, Taylor students during office hours for free. And I'm also contactable on Facebook. Although if you're not, it's a little bit, you have to give me a bit of time because sometimes I don't see the other emails on Facebook. Okay, so those are two ways of going about it. Bye-bye. Thank you for listening. And I apologize. I know I said some stuff a bit out there, and I apologize if I kind of hurt anybody's sensitive feelings. But y'all are millennials, and I know you can take it. But as a boomers, you get hurt a lot. It's okay. So it's like,
All good, Doctor. All good.
yeah, I think so too. Bye-bye.
Bye, Doctor. Thank you, Doctor.
You, Dr.
Hey,
A.
thank you all. It was fun.
It was. Thank you very much. Thank you, everyone.
Thank you,
Bye.
guys. Bye.
Have a good night.
I think Crane can